My name is Mr. Peter Vasas, consultant bariatric surgeon. I started working for the Practice Plus Group in 2024, dealing with metabolic and weight loss surgery. I started learning this surgery more than 10 years ago when I noticed that we make a real change in people's life, and not only the weight reduces but the associated comorbidities also settle. It has an amazing outcome on high blood pressure and on type 2 diabetes, and this is the first real change in the diabetes condition of the patient, and I was amazed. I perform between 3 and 5 surgeries per day, 100 and 150 cases per year. We need to have a thorough preoperative assessment and post-op follow-up care to address all people's needs. Weight loss injections certainly have a place in the weight loss journey. They induce some initial weight loss, but in longevity, I think the injections are not sustainable. After 1 or 2 years will come the point when the patient's weight loss fades away, and this is the point when they will choose and to opt for further surgery. So the good candidate for weight loss surgery are those people who fit the BMI criteria. This has been reduced 2 years ago by the International Federation of Surgical Obesity, and currently the BMI 35 is the lower limit, or down to 30 if you have weight-related medical comorbidities. Recently diagnosed diabetes is a very good example that people should think about weight loss surgery, because if the surgery happening in the first 1 or 2 years can very effectively and quickly reverse this condition. We can perform 2 different types of weight loss surgery at the Practice Plus Group. One is the gastric sleeve, which is the 80 to 85% volume reduction of the stomach. It is called a restrictive procedure, when simply from the big stomach we can make a way smaller stomach. How I normally explain to the patients is that from the 1500 mils capacity of the stomach, which is like a small melon, we go down to the size and shape of a banana. So this is less than 200 mils volume. That means that the feeling of satiety comes way earlier, so smaller amount of food will be enough to feel full. There are hormonal changes as well, that these patients not seeking that much food after surgery. The other type of surgery is called the gastric bypass, which has 3 effects. One is that there is a significant reduction in the volume, so the size of the stomach will be just slightly bigger than an egg. From the less consumed food, less calories get absorbed. The most important thing is the hormonal change. After the gastric bypass surgery, the GLP-1 level of the patients increasing significantly. The operation provides that amount of GLP-1 injection which you can buy from the pharmacy, and this is for many years. One of the benefits is to come to the Practice Plus Group, that here we created a package which not only contains the preoperative assessment, but comes with the high quality surgery and the professional follow-up for 24 months. The journey does not finish with the operation itself, it just starts it. The patients get a professional dietitian's follow-up, so not only nutrition advice, but regular mineral and vitamin consumption advice and checkup happens, and if required, we can intervene to prescribe and give the appropriate medications, nutrients, or vitamins. At Practice Plus Group, we open to provide fast access gastric surgery. Here you can expect surgery within 4 to 6 weeks, obviously depending on your medical condition and other circumstances. After weight loss surgery, the weight loss begins very quickly. Normally we quote 18 months to have the final and sustained weight loss. The first 9 months is quite quick, so you can expect almost a stone weight loss per month. The second 9 months is kind of slower down, but requires usually 18 months to see the final outcome. We can predict from the initial height and weight numbers the amount of patient expecting to lose with a different type of surgery. After weight loss surgery, you will have a way smaller stomach, so it means that you will achieve the satiety with less amount of food consumption. So after eating a few bites, you will feel that naturally that you're full, you don't feel hunger anymore. You will expect 6 to 8 weeks of an adaptation to the new diet. In the first 2 weeks, you just should consume liquid diet. So it's like a lot of soup, very liquidy yogurt. But after 6 to 8 months, you can return to your normal food and you will be able to eat normal consistency of food with a reduced amount with that good satiety and good feeling. After losing this significant amount of weight, there are new doors which will open in your life. You will be able to do certain activities what you didn't, whether you were physically restricted or just emotionally restricted from that procedure. A lot of people start various sports. You can go to the swimming pools. A lot of people start skiing after that. So it opens up a completely different lifestyle.